Hi, I'm Paula and this is Greg. And we're here today to talk about meningitis.
Now remember, Paula, Miss Jackson said to keep this presentation clean.
Yeah, I promise I will not cuss, and I think my clothes are appropriate. First, let's talk about what meningitis really is.
Good, because I'm not exactly sure what meningitis is.
Meningitis is an inflammation of the meninges, which are the membranes that cover the brain and the spinal cord. People of any age can get meningitis, but because it can be spread so easily among those living in close quarters, that makes teens, college students, and boarding school students at a higher risk for infection.
So that means it needs to be dealt with quickly, so it can be treated successfully. So it's very important to get routine vaccinations, know the signs of meningitis, and get medical care right away if you suspect your child has the illness.
Exactly, but do you know what causes meningitis?
Just because I failed the PEDS ATI doesn't mean I don't know what causes meningitis.
You're stupid.
Okay, I'm kidding. Meningitis is caused by bacteria or viruses, but in some cases it can be caused by certain medications or illnesses. Many of the bacteria and viruses that cause meningitis are fairly common and causes other routine illnesses. Both bacterial and viral meningitis spread like most other common infections. The disease spreads by the infected person either touching, kissing, coughing, or sneezing on someone who isn't infected.
Okay, so maybe you do know what causes meningitis.
Of course I knew. And do you see that sign behind me that says keep your hands to yourself?
Nope, I sure didn't.
Ouch! Okay, since you're so smart, why don't you tell me the difference between bacterial and viral meningitis then?
My pleasure. Bacterial meningitis is rare, but is usually serious. It can be life-threatening if not treated right away. In some cases of bacterial meningitis, the bacteria spreads to the meninges from a severe head trauma or a severe local infection, such as a serious ear infection or nasal sinus infection.
Are there more than one type of bacteria that can cause meningitis?
Yes, there are several. In newborns, the most common causes are group B Streptococcus, E. coli, and less commonly Listeria monocytogenes. In older children, Streptococcus pneumoniae and meningococcus are often the causes.
Wow! Bacterial meningitis has a lot of causative agents. What about viral meningitis?
Viral meningitis is also called aseptic meningitis. Viral meningitis is more common than bacterial meningitis. It is also usually less serious. Many of the viruses that cause viral meningitis are common, such as those that cause colds, diarrhea, cold sores, and the flu. Have you ever been around anybody that has displayed signs or symptoms of meningitis?
While working last week, we had a patient that was diagnosed with meningitis.
What were their recognizable signs and symptoms that you noticed?
Well, meningitis symptoms vary, depending on the person's age and causative agents. First symptoms can come on very quickly or start several days after someone has had a cold, diarrhea, vomiting, or other signs of infection. However, the common symptoms of meningitis include fever, lack of energy, irritability, headache, sensitivity to light, stiff neck, and a good old skin rash.
You said that symptoms vary depending on a person's age. Does an infant display different signs and symptoms?
I'm glad you asked that. I'm about to tell you that now. Infants with meningitis might have different symptoms. Babies might be very irritable, feed poorly, and be sleepy or difficult to wake up. It may be hard to comfort them, even when they are picked up and being rocked. They also may have a fever or bulging fontanelle. Other symptoms in infants can include jaundice, stiffness of the body, a lower than normal temperature, a weak suck, or a high-pitched cry.
Meningitis sounds like a serious disease. If any of the previous signs or symptoms are experienced by you or anyone you know, seek medical treatment right away.
Once seeking medical treatment, what would the doctor do based on those signs and symptoms?
The doctor would order tests, including a lumbar puncture, to collect a sample of spinal fluid. This test will show any signs of inflammation and whether the infection is due to a virus or bacteria.
After being diagnosed with meningitis, what would the treatment options include?
Most cases of viral meningitis end within 7 to 10 days. Some people might need to be treated in the hospital, although children can usually recover at home if they are not too ill. Treatment to ease symptoms include rest, fluids, and over-the-counter pain medications. If bacterial meningitis is diagnosed or suspected, the doctor will start IV antibiotics as soon as possible. Fluid resuscitation may be initiated to replace fluid loss due to fever, sweating, vomiting, and poor appetite. However, if a person does not recover after these treatment options, further complications can arise.
Wait, I remember reading about the complications of meningitis. Some children may require extra oxygenation or even mechanical ventilation if they have trouble breathing. Bacterial meningitis complications can be severe and include neurological problems such as hearing loss, visual impairment, seizures, and even learning disabilities. Because impaired hearing is a common complication, those who have had bacterial meningitis should have a hearing test after they recover. The heart, kidneys, and adrenal glands also might be affected depending on the cause of the infection. Although some children develop long-lasting problems, most who receive treatment recover fully. As bad as these complications sounds, there is preventative measures that can be taken.
You're correct, Greg. Routine immunizations can go a long way towards preventing meningitis. The measles, mumps, polio, and pneumococcal vaccines can protect against meningitis caused by those germs. Children should also receive the meningococcal conjugate vaccine when they are 11 or 12 years old, with their booster shot at 16 years old. Children older than 11 years of age who have not yet received the vaccine should be immunized, particularly if they're going to college, camp, or other settings where they live in close quarters with other individuals. A newer type of meningococcal vaccine called MB, which protects against the type of meningococcal bacteria not covered by the older vaccine, can be given to teens and young adults at the discretion of their doctor.
The best preventative measure is hand washing, which should be performed frequently and performed well. This should be performed before eating, after using the restroom, or if a person works closely with children. Avoid close contact with someone who is obviously ill. Do not share food, drinks, or eating utensils to also stop the spread of germs. In some cases, doctors may give antibiotics to anyone who has been in close contact with a person who has bacterial meningitis to prevent infection. Yes, that was a pretty good job on explaining meningitis. Now let's hope Miss Jackson will give us an A on this project.